Hello, this is Dr. Jazayeri. So I wanted to talk to you about the situation that comes up, unfortunately, sometimes for these patients, and they call me frantically, and I think, wow, what's the emergency? And well, it's very traumatic for the patient. They have a leaking or a leaked saline implant. And so I always talk to patients about this at the consultation too. So the advantage of a saline implant is that when there's a leak, the salt water leaks out and the implant gets smaller and smaller, so the patient knows there's a leak. The disadvantage is that there is a leak, and so the breast will be lopsided. Whereas with silicone implants, the silicone gel and the new generation, they don't leak out, like they're not watery, they just kind of stay there. And I'm sure there are patients with leaked with cracked silicone implants that probably don't even know about it. And clinical exam is not accurate. They've done studies, basically the plastic surgeons, 50% of the time guessed it right. So it was like flipping a coin. So then an MRI used to be the gold standard, but a high definition ultrasound is also very accurate, and it's less expensive. But going back to the saline implant, so there's no danger, obviously, to a leaked saline implant. I mean, the shell has always been there, and now you've lost the volume. And it's not an emergency, but I have to add the but. So when an implant is completely deflated, it's essentially like an implant has been removed, correct? And so what I noticed when I took these implants out, let's say patients wanted their implants out for whatever reason, what happened, this breast fold started contracting upward. So when the fold was here, it kind of contracted upward, and so the skin would then slide over the fold. And it wasn't very attractive, and then when I wanted to, let's say they wanted to put a new implant back or something, and this happened with implant infections too, when we took the implant out. It was much harder to get that fold back where it wanted to be or where it used to be. So if you do have a leaking implant, what I recommend is purchase a breast band. You can order them from Amazon or whatever you want to. It's basically a strap, and it has a Velcro, so you put it on and the Velcro holds it in place. Now here's the key. I'm going to go up a little bit so you may not see my face a little bit. So one side has an implant, right, and the other side doesn't. So you don't want to put the band across. You want to so if this side is deflated, you want to put it more like that. So you want it to really be at the center of that deflated breast to hold, to push that breast down against your natural fold, because we don't want that fold to contract, right? And I would probably just wear that band until you get your surgery done, because you don't want that fold to contract, or minimize the risk of it contracting. So that's my 2 cents for today. I hope that will help you get a better result. Unfortunately, if you have a deflated implant, the good thing with the FDA approved implants now is there's a lifetime warranty on the implants, and there's some financial assistance. And I don't want to give you the detail because each company may have their own different thing. But as far as I know, all FDA-approved companies have a lifetime warranty for saline and silicone if the implant should leak. So at least you'll get your implants for free. All right, well, take care and be safe. Thank you. Bye-bye.